If
Sounds
it's
good.
Friday morning, it is time for the About Mansfield Consumer Advice Series. And today we are talking about your health as we do every Friday morning right here live on Facebook. And because chances are you or someone you know suffers from migraines. And so this in the continuing education of migraines. We have him here live on Zoom. Dr. Joseph Adams from Calibration, Chiropractic, and Functional Health. Say hello to the audience.
Hey, everybody. Good morning.
And we got that massive United States right behind your right shoulder there.
Yeah, yeah.
It looks awesome there. So today we're talking again about migraines. And last week we touched on some neurological causes of migraines, but I have a feeling that we didn't finish neurological because there are some more neurological causes about migraines, are there not?
Yeah, that is correct, Steve. So last week we talked about eyes and how having a binocular vision disorder, basically meaning your eyes not syncing up and moving correctly, very different from the vision your optometrist checks for, could cause or contribute to a migraine disorder. And there is more to it than just that. So there's the eyes, but there's also your balance centers. And that's a layman term that I use to describe your vestibular system, which is behind the ears here, which is like a gyroscope in your head that helps you figure out where you are at in gravity. And so that area of your brain, those organs of your brain can actually have a hypo function and can lead to some types of migraines.
The All right, so over the series you've talked about different, I believe it was the
SOT, yeah.
SOT muscles now here. Now you're talking about muscles behind the ears and how they all play, and if they're not all working properly, it can lead to migraines.
So to clarify that point, deep within inside your head, behind your ears, like deep in the skull, you have an apparatus called the vestibular system, and it detects motion. Like when you're in a car, like your brain can pick up if you're moving this way, right? Everybody's experienced this, right? Especially on an airplane, right? I mean, when you or a roller coaster, you take off really fast. I mean, how do you know you're going that fast? What's your vestibular system, which is behind the ear? And then it also detects motion up and down. And so that system, if it is not working correctly, can cause migraines. There's a very specific type of migraine that it causes, and then there are some other subtler comorbidities with this that could contribute to migraines.
All right, so someone's been on a boat for several hours and gets that rocky feeling back when they're on dry land. Does that have anything to do with the system that's going on behind the ears, and you can't seem to level yourself out?
Exactly. That's a really good example of what I'm talking about, because these vestibular apparatuses, as they're called, behind the ears, there's one on each side. And a lot of times when you do get on a boat, they're getting stimulated like all the time, right? Because you're on the boat. And then when you get off the boat, they don't necessarily go back to normal as quick as we would like them to. And so some people do experience issues like this that is related to a migraine disorder on a daily basis. And so they may actually feel a little off, like they're on a boat. That may happen. And then they may get head pain. And that is a very specific type of migraine. It's called vestibular migraine.
Yeah. Okay. And what is that called? Vertigo. Is okay. Does vertigo lead to migraines?
So vertigo can be a component of migraines. And so that's exactly what we're talking about here, is that a lot of times there are people who suffer from a very specific type that makes them feel like they're spinning, right? So maybe they're spinning to the left, maybe they're spinning to the right, maybe the world's spinning to the left, maybe the world's spinning to the right. Or more commonly, what I see is people, I'll ask them those questions and people are like, yeah, I just kind of feel off. And that'll happen before the head pain starts. And so really what's triggering the migraine is problems in their vestibular system. The good news is this is a very easily treatable migraine type of condition. It's actually the one that we get the best results with because we can rehabilitate your vestibular system in office using physical therapy.
Wow. And okay. And I would assume this happens with people as they get older because I never suffered from vertigo or from having been on a boat, or now I get it even with long airplane rides, 3 or 4 hours or more. I get off, and several hours later, I'm still like, but I never suffered from that before. Is it a condition that happens with people who get older?
I would say that it is more common to see vestibular problems in general as you get older. One of the more specific ones that we see a lot in office as well is BPPV, which is an acronym, and it basically means that you have like a stone loose deep inside your vestibular system, like a little crystal, and that crystal is like tapping on the nerve in your vestibular canal, and it's making you feel dizzy. And so that's very easily fixed as well with a specific maneuver. And we do see a lot of that in office, but that is more of a separate type of situation. But I would agree with you, as you get older, you're more likely to have that condition and more likely to have more vestibular type dizziness, vertigo type of symptoms overall.
Well, I was going to make a joke about I've had stones loose for years, but let's get back. You hit a key word right there: dizziness. Do people
Yeah.
experience dizziness before experiencing a migraine?
Yeah, so they can. So that's usually the telltale sign. If somebody comes in and I'm sitting in front of them and they're telling me about what's going on with their migraines and they mention that they get dizzy, the first thing I got to rule out is that this is not a vestibular problem, not a balance center problem as the primary cause of their head pain. And so it's very common. Now, on the flip side of that coin, you can have people that once you get into a migraine, so once you have head pain and you've had it for a little while, you may start to get dizzy. And that is a different type of scenario. It may not necessarily be vestibular migraines. It may just be that you're in that bad a shape at that point that that system is just going haywire and now you're dizzy. And we do hear that a lot, even with severe tension type headaches as well.
And what is the process then if someone comes into your office there at Calibration Chiropractic, and so they say, I'm either off balance or I'm experiencing dizziness. What's the first process that Dr. Joe does with the patient?
So after we do a history and understand what's going on, the testing, the examination is the next step. And in our office, we have some of the most high-tech diagnostics for this. So I actually have a force platform, and you stand on this and you can move your head in certain directions and close your eyes, keep your eyes open, and we can see what part of your neurology, what part of your body, if you will, is causing this dizziness. We also have another piece of technology that locks onto the eyes. And we may have discussed this last time with infrared cameras, and it can actually measure how well your eyes move. And so between those tests and my neurological exam, we can get a pretty good idea of what the primary cause of the dizziness is. And then, like I said earlier, we can treat it with therapy most likely to get the person better.
All right. And so if someone had more questions about migraines in general or your chiropractic service or your chiropractic practice, terminology. All right. If someone had more questions, how can they reach out to Dr. Joseph Adams?
Yeah, you can find us on Facebook, Instagram, Calibration Chiropractic and Functional Health, on the web at Calibration Mansfield. We're on YouTube, and we're very easy to get. You message us through any of those platforms, and we're always happy to sit down and have a complimentary consultation. Spend 10 minutes with me, tell you if I think I can help you. If I can, then we'll do an exam. If not, then we'll tell you who most likely can, and no commitment.
I have dubbed him Mansfield's foremost expert on migraines. This is, again, the continuing education. We do this weekly here on Facebook Live. And if you missed the live, you can head on over to YouTube or LinkedIn and catch the video. This is Dr. Joseph Adams, Calibration, Chiropractic, and Functional Health right here in Mansfield, Texas. Joe, you and Jordan have a great weekend. We'll see you next week.
We'll see you, buddy. Take care.